Bismillahirrahmanirrahim. Assalamu alaikum. In this video, we will continue our discussion on multiple choice questions. We will explore further into our previous topic, that is the techniques for open extraction of multi-rooted teeth. At the end of the MCQ discussion, I will explain the related content from which the MCQ was created. During a mandibular first molar extraction, the oral surgeon decides to use an alternative method involving the sectioning of mesial root from the tooth. After sectioning the mesial root, which instrument is typically used to extract the crown with the mesial root intact? Not used for extracting the crown, used for elevating the remaining root after crown extraction, used to extract the crown with the mesial root intact. This is the correct option. An alternative method of sectioning is to use the burr to remove the mesial root from the first molar. Using a burr to section the mesial root helps in dividing the tooth into two manageable parts, facilitating easier extraction. Then the number 178 forceps is used to grasp the crown of the tooth and remove the crown and the distal root. The number 178 forceps are specifically designed for gripping and extracting the crown along with the distal root, streamlining the process of tooth removal. Not used for extracting the crown, used for luxating and mobilizing roots, not for crown extraction. So the correct answer is C. The crown with the mesial root intact is extracted with number 178 lower molar forceps. Next is, after the crown and the mesial root of the first molar have been extracted, the oral surgeon uses an instrument to elevate the remaining root from the socket. Which principle is applied when using a crier elevator to elevate the remaining root? Not applied in this specific use of crier elevator. Not relevant to this procedure. Used when the crier elevator is rotated to elevate the root. The crier elevator is then used to remove the root, this one, mesial root. The point of the crier elevator is inserted into the empty socket of the distal root. This is the empty socket of the distal root, and turned in a wheel and axial fashion with the sharp point engaging the interseptal bone and root, elevating the mesial root from its socket. Using the crier elevator in this manner ensures effective removal of the mesial root by leveraging the interseptal bone and remaining root structures, ensuring a complete and clean extraction. Not the primary principle used here, not applicable to this context. So the correct answer is C. The elevator is inserted into the empty tooth socket and rotated using the wheel and axle principle. The surgeon has removed the crown of the lower first molar using the number 178 lower molar forceps. Now the mesial root remains in the socket. Which instrument and technique are used to remove the remaining mesial root? This MCQ is more or less similar to the previous MCQ, so you can easily solve. Not applicable for root removal, using for elevating the remaining mesial root. Correct answer. Incorrect instrument for this stage. Not applicable for larger root sections. Not specifically used for this technique. So the correct answer is B. The crier elevator is inserted into the empty socket of the mesial root and turned in a wheel and axial fashion as described in previous slide. During a difficult lower first molar extraction, the surgeon removes sufficient bone to expose the bifurcation. What is the purpose of removing buccal bone during this procedure? Not the primary purpose. For easier root sectioning. Correct purpose. To facilitate the use of forceps. This is a secondary benefit, but not a primary. Incorrect rationale. not applicable in this context. So the correct answer is B. The soft tissue flap is reflected and sufficient buccal bone is removed to expose the bifurcation. Let's discuss the content from which the multiple choice question was created. We discussed one method for removing lower molar in our previous video about MCQ number 4 from lecture 3 part 2. However, there is an alternative method. Reflecting the soft tissue flaps provide better visibility and access to the underlying structures, while removing buccal bone exposes the bifurcation, making it easier to section and remove the roots. Sectioning the mesial root transforms the molar into two separate single-rooted teeth, simplifying the extraction process by allowing the surgeon to handle each root individually. Using number 178 lower molar forceps to extract the crown with the distal root intact helps in removing the bulk of the tooth, making it easier to address the remaining root later. The cryer elevator is specifically designed to engage and elevate the root. The wheel and axle principle allows for the effective leverage, making it easier to dislodge the root from the socket. Engaging the cementum of the root with the sharp tip of the elevator ensures a firm grip, allowing the root to be lifted out of the socket with controlled force. When dealing with the dense interradicular bone, initial rotations of the cryer elevator help to clear the bone, providing better access to the root for subsequent extractions. Thank you. Wish you best of luck.